Okay, hi, this video is the art of hair transplant restoration surgery result on Eugenia. She's gonna share the experience with us, but before she does that, I'm gonna show the audience what she looked like before, and that's what she looked like. She's thinning from the both sides, and most African American women have this type of genetic hair loss, and that's before, and this is after a year later, full set of hair. And again, the right side, you see how much she thinning, and the right side a year later. The left side, a year later. Top view, we lowered like an inch. Look at that, perfect density. So I'm gonna leave the stage to Eugenia, and she's gonna share her experience from the beginning with us. So go ahead, Eugenia.
Hi, I'm here with Dr. Diep today, and I am 1 year post-transplant. And I just want to share my hair transplant experience with you guys. It was quite an experience for me. First of all, let me say Dr. Diep is a great doctor. He was always there to answer every phone call, every question, every email. And if he wasn't available, his staff was available. Hair loss for me affected me in such a way that I covered my head, I wore weaves, I wore wraps, the whole 9 yards. And the thing about weaving hair into your head, it pulls the hair even more. So I was doing more harm than good. So for years, I was weaving this hair into my head, and it caused me to have tension alopecia. I came to Dr. Diep, and he saw what was going on. He said, immediately stop wearing weave in your hair. It's not doing you any good. And we're going to start with this process. So prior to me finding Dr. Diep, I was just online one night, and I was just searching through YouTube videos. How do I grow my hair back? How do I grow my edges back? And there was a young lady, her name is Destiny Godly, and she started talking about Dr. Diep and her process. I watched every last one of her videos, and that's how I found Dr. Diep. I chose Dr. Diep because he was, out of all the doctors that I saw, he was more experienced with black hair care. And what I mean by that, he was not trying to give me this straight hairline. He wanted to make my hairline as natural to my hairline as possible. He even referenced the term baby hair, and I was like, wow. So he knew some stuff about my hair, so I felt good about that. Let's see here. Surgery day. Surgery day, I was very scared. I nervous, but Dr. Diep came in, he talked to me, he reassured me that everything was going to be okay. He gave me a few sedatives to make me relax, and I woke up with a plate of food in my face. It was time to eat, and then I went back to sleep, and he finished the surgery off. I went back to the hotel room that he provided, and I came back the next day. They washed my hair, they spoke to me a little bit more. I went home, and I was okay. For the next year, I was trying to figure out, how do I wear my hair? What do I do with my hair? So I wore head wraps, little scarves, very light on my head, never touching the graft site, never touching the hair. If I did wear a wig, it was behind the hairline. It was never rubbing against the hair. That's what he told me not to do, so I said I'm not going to do it.
And then, so basically, when did the the hair begin to grow for you?
The hair began to grow. I noticed hair growth maybe 6 to 7 months after the surgery. And just recently, my girlfriend came by, and she said to me that, she was like, oh my God, your hair is growing so long. And I said, really? And she said, yeah, your hair looks good. And, you know, she kept fingering it and combing through it. and brushing it back, and that's when I really started to notice that my hair was actually really growing. I kind of forgot about it a little bit. I mean, I always knew that it was there, but I just felt like, okay, I'm not gonna worry about it every single day because that's gonna make me crazy. But when she came by, it made me realize that my hair actually was thicker, it was longer, it's blendable. I can pull it back. I'll give it a few more months and I'll really be able to put it into a ponytail. But for the most part, I have edges. And for any black woman, you know what it feels like not to have edges. You know what the embarrassment, the shame feels like to have long hair and no edges. So I personally feel like it helped my self-esteem. It helped my confidence to be able to wear my hair back in ponytails now, to wear it off of my face now, and not put powders or creams to hide my edges, you know? So.
Yeah, you know, and we just a year out, so and the length is not very long right now, but the density is there, and actually sometimes it take a year and a half to fully grow, and a year and a half later, maybe 6 months when it's longer, you can tie your hair much nicer. The great thing is, you know, Eugenia hit on a point that she knew she was thinning, she knew she had a surgery done, but she forgot, and she was floored when I showed her what she before looked like.
Yeah, I forgot.
You know, because hair grows so slowly. So a lot of people won't know. And the other important point I wanted to emphasize is the audience always asks about doing the recovery because we had to shave to transplant the area in the frontal area. So it's hard for people to go back to work and what people know.
Yeah.
So what Eugenia did was if she wear a wig, it sit all the way in the back.
All the way in the back.
And then have the hair sit forward.
And I had the hair to come forward like a bang, but it was never pressing against my hair.
The transplant.
The transplanted hair, it never did that. And even when I wore scarves, I always wore scarves here. It never pressed against the transplant hair. I was so scared that my hair was going to come out that I didn't want to do anything to mess it up. So the healing process, everyone heals differently. I went back to work maybe 4 weeks later, 3 to 4 weeks later. A little bit of pain. Dr. Diep provides medication for that, but with every surgery there is going to be a process of healing, and sometimes healing there's a little bit of pain, but you get through that.
And you know, now you on the other side, right?
Yeah.
Being a nurse, you take care of people
right.
with pain and swelling. Now
Right.
you're on the other side, so you empathize with the patient.
Yes, I totally understand. I get it. I'm sorry.
But again, thank you, Eugenia,
Thank you, Dr. Diep.
to showing the full face
Yes.
and allow me to